Okay, so uh, what is APC and what is its function? So APC is a gene that is located on chromosome 5, mm, and has many intracellular functions. One of the most well-described rules in the WNT wingless related integration site signaling pathway. So APC encodes a factor that negatively regulates the VNT pathway in colonic epithelium by promoting the formation of a complex that degrades a beta-catenin. So, so APC gene produces every gene produces protein. So APC will also produce a protein which is combined with some other factors and form a complex which is destroyer or terminator for the beta catenin, because beta catenin always signal the nucleus to divide or to grow. So that's why it keep a check on the beta catenin function. So what is the function of beta catenin? Beta catenin plays an important role in WNT pathway. So it stimulates the nucleus through WNT pathway, and this complex with the E-cadherin maintains the normal tissue architecture. Any alteration of these so beta catenin has two functions. So one, it on one side beta catenin on one side it uh, uh, cell division help in cell division because it transmits signals, on the other side it is attached with the E-cadherin, so they help in adhesion of the cell. So okay, so we are going to discuss it here. So let's suppose we have the resting cell, we have the WNT stimulation, and we have the tumor cell, mutated cell. So what's going on normally, that WNT receptor, they and there is APC with some other factors, they form a destruction complex, and this is the beta catenin. So the APC destroy the beta catenin or inactivated, and it cannot stimulate this cell. And also the beta catenin is attached with the E-cadherin, and so they form adhesion of the cell, help in adhesion of the cells together. Okay, so what happens normally, this is a normal mechanism. So WNT pathway stimulates this WNT receptor, it gives a signal to APC and beta catenin as well. So beta APC normally relieve it when it is stimulated. APC when stimulated by WNT pathway, it release or relieve the beta catenin to do your function. So beta catenin stimulate the TCF transcription factor in the nucleus, so it will the cell will start dividing. And when the tumor cells with mutated APC, so when the APC is mutated, so WNT pathway will stimulate the beta catenin, or not only the WNT pathway. If the APC is mutated, so it cannot destroy the beta catenin. So beta catenin will be free. There will be no check for him. So it will constantly stimulate the nucleus, and there will be proliferation. This proliferation is then we call tumor. So this is the beta catenin and APC and uh, this all. What is TNF? What is its function? So tumor necrosis factor other names include TF, cachexin, cachectin, TNF alpha, which is a pro-inflammatory cytokine. TNF is secreted by inflammatory cells, predominantly produced by the macrophages, but can also be secreted in limited quantity by B cells. Natural killer cells, endothelial cells, and muscle cell, fibroblast cells, and osteoclast cells may be involved in inflammatory associated carcinogenesis. Regulation of immune cells and acute phase reactions, multifunction, involved in cell survival, proliferation, differentiation, and death. So TNF on one side help in to decrease the inflammatory process. Sorry, on one side it fights the bacteria, the invading organisms, but on the other side, since it's pro-inflammatory, so it causes damage by inflammation as well. Okay, so TNF is basically produced by the macrophages, but can also be secreted by B cells, natural killer cell, endothelial cell, muscle cells, fibroblasts, and osteoclasts, and is a pro-inflammatory. In other words, TNF is endogenous pyrogen, induce fever, apoptotic cell death, cachexia, and inflammation because it causes negative nitrogen balance, inhibit tumorigenesis and viral replication, yes, and respond to sepsis through interleukin 1 and interleukin 6 production. Role of TNF in inflammatory bowel disease. So, TNF and other immune mediated signals direct epithelia to increase tight junctions permeability. So, let's suppose these are the cells of the wall of the gut, okay, and we have the TNF. TNF orders it to increase this permeability. So, bacterial contents, other inflammatory contents go inside the wall, like here, go inside the wall. So when they go inside the wall, so every like the inflammatory cascade is activated. So this can cause inflammation. So that's why in IBD inflammation occurs. So TNF and other immune mediated signals direct epithelial to increase the tight junction permeability, which increase the flux of luminal bacterial components, which activates innate and adaptive immune response. They will activate the innate and adaptive immune responses. So there will be immune responses, so it will lead to inflammation. So what drugs antagonize TNF? That's why we use infliximab, adalimumab, sartorizumab in inflammatory bowel disease to stop TNF production, and so it will not cause this thing or this thing, which I discussed. Mechanism of action of these drugs. So they monoclonal antibodies, IgG1 antibody to TNF. So they are monoclonal antibodies, so they destroy TNF or block TNF. Why are they used to treat ulcerative colitis? Because they are called biologics, used mainly in steroid refractory ulcerative colitis cases and for the treatment of extraintestinal manifestation. So when UC is steroid resistant, so in such cases we use this because they are very severe kind of disease. So this was all. Now let's discuss a bit about this diagram because we have time. Okay, now we are going to discuss the a bit this diagram. We have this okay, so we have this okay, so we have this diagram. So you can see here that the barrier defects leads to influx of the bacterial components into the this wall of the bacteria. This is the wall of the big intestine. So this is the wall of the intestine. So bacterial defects lead to influx of these bacterial components or immunogenic components. So they go inside the and here also bacterial components. So the dendritic cells. So you can say that gut wall becomes leaky. Bacterial components go enter the mucosa or the wall. So what happens? The dendritic cells here. These are the dendritic cells. The dendritic cells, they detect these bacterial components and release interleukin 8 and interleukin 23. So here we have the interleukin 23 and interleukin 8. So what do interleukin 8 do? It calls the extra neutrophils. It will call extra neutrophils. What do the interleukin 23? It activates the T helper 17 cells. It will secrete interleukin 17. Okay. So it will secrete interleukin 17. And also the CD4 T cells, they activate the T helper 17 and they will release interleukin 17. Also the T helper, the CD4 T cells, they also secrete interleukin 12, and also they activate the T helper 2 cells as well. So they will secrete interleukin 13, and they will interleukin 12 will activate the T helper 1, T helper 2. Okay, and so here we have uh, this whole combination, this storm of you can say uh, this interleukins, and this will cause inflammation. This will cause inflammation. So this will be, here will be repeated inflammation, and so this also, the T helper 1 secretes the interferon gamma. So this will lead to oral inflammation of the gut.